Hi everyone, it is Dr. Ericka. You probably noticed I have a different background. I literally just got in from Chattanooga, so I'm coming to you straight from my car because I wanted to be on time. So I'm on time just for you. So if you're coming in, let me know how you're doing today and where you're coming from. So today's tip, we're doing a daily mental wellness tip today. The tip today, and I'm trying to make sure I'm in frame. I think I am. The tip today is ask for help. So I'm excited to be here with you. Hopefully I'm not looking too many crazy places, but hi Valerie, thanks for hopping on. The first thing is, if you feel like you know someone that needs this, share or tag them. If you're watching this later, no worries. Hashtag replay. The show must go on, so I'm on here from my vehicle. So what I'd like to get started with is, we talked about the title today is going to be Ask for Help. That's going to be the tip we're talking about. Again, I am Dr. Ericka, double board certified psychiatrist, integrative lifestyle coach, and best-selling author. I'm on a mission to help women feel seen, valued, and whole on their own terms. But today I come here to you, no matter your gender, just to make sure that I'm doing my best to help you get through all of this with your sanity intact, especially since I have over 15 years of experience in human behavior. So today we're talking about ask for help. The reason we're talking about this, I was having a conversation with someone, and I gave a presentation earlier today, and we were talking about when people are struggling, and the thing that's difficult is a lot of times people, especially women, but this happens for a lot of people, but a lot with women, is that we're so used to making things work or caring for other people that we don't ask for help. And this also is relevant. I was having a conversation about Black people, and a lot of times we're taught to be twice as good and do all this work and somehow make it work, and sometimes we're unsupported, so we're not used to asking for help either. So the reason it's important to ask for help is, number one, there's no reason to be struggling when you don't need to. So a lot of times if you ask for help, you can actually get assistance. The second is, if you look like you're okay, you say you're okay, everyone is going to think you are okay. They are not going to magically, psychically know that you are not okay and intervene on your behalf. You have to actually let people know what you need and that you need some help. The next is that, especially in the world of mental health, sometimes you can't do it on your own. Sometimes some Oprah, some Deepak, some meditation, some yoga, it just will not do it. You cannot spa it away. You can't hot bath it away. And in those times, sometimes you actually need to get some professional help. But at the end of the day, it's not a shame to ask for any kind of help. The hard thing, and what ends up being a shame, it's not something to shame you, but it ends up being a shame. Pardon me, I need to rest my hand on something. Is that you're sitting there struggling on the struggle bus when you don't need to be on the struggle bus. And at this time, a lot of us are dealing with so many challenges, between the challenge of the pandemic and the challenge of the dehumanization of Black people, the continuing murders of unarmed Black people, and just the overall responses to it, is that sometimes you need a little help, and just you need to be able to ask for it, be it from a friend, a coworker, family, or a professional. But at the end of the day, if you don't let people know you need help, you most likely will not get it. And there's just no reason to be suffering just to suffer. And as I say, when it comes to taking care of people's mental health, is it's a lot easier to fix something early than once it's a crisis. It's kind of like you look at other medical illnesses like diabetes or blood pressure. It's a lot easier to get it regulated and treat it when it's just a little bit of an elevation, versus if someone's got diabetes in there and diabetic ketoacidosis, or someone has super high hypertension now, and now they're in hypertensive urgency, or having a cardiovascular event, or having a stroke. So there's no reason to wait until things get to a crisis to get help. So I am safe. It's Valerie. Where I live right now, it seems fine. I'll probably talk about it tomorrow, but Atlanta right now is as much my home as St. Louis is. And just as if you have family sometimes and it's your favorite family member and they do something and you don't like it, but you still love them. Atlanta is going through some stuff right now. And I won't lie, there was a time where people acted like this was Wakanda. I knew it wasn't really Wakanda. Wakanda doesn't really exist except in Marvel Universe. But I think the reality of the fact that even though Atlanta has so many powerful, educated, change agent type people that are willing to do the work, people that are open, people in power, socioeconomic blocks, that we can still be having the same struggles as any city. And the fact that it's really a reflection of the country, that you can still be in Atlanta with our black mayor, our black, city boards, all this stuff that's blackety black, and still be struggling with the same issues everyone else is, with police brutality, people being killed, police walking out because they just aren't feeling the situation. We're dealing with the same stuff you could anywhere else. And I think this is just a wake-up call that you can't be complacent no matter where you are, no matter how black it seems or how progressive it seems. This stuff is just pervasive. It's everywhere. So that's what I got for you. Ask for help. Don't struggle alone. There's no reason for you to be on the struggle bus when there's so many people to help you and so many resources. People don't know if you're hurting. People don't know if you need help. People don't know if you're struggling if you do not say something. So please let people know so that they can support you. I know there are plenty of people out there that love you, and there are plenty of professionals out there if you need professional help. Hi, Dr. Dia. Thanks for coming on. I think I said hi to Dr. Charlotte. Thanks for coming on, Valerie. And that's pretty much what I got for today. And on that vein is that if you need help, get it early. And I do have a telepsychiatry practice. So if you're feeling overwhelmed, if you're feeling like things are just too much, you feel like your emotions are out of control, you feel like you're crying all the time, you feel like you just can't keep it together, you can't put that mask on one more day, then Goodwin Medical Associates may be for you. I have an adult telepsychiatry practice. Even though I'm a child psychiatrist right now, it's just adults, that is giving very customized, high quality care from a Harvard trained psychiatrist that is customized and comes to you. So you have the maximum amount of privacy. Since it is a cash-based practice, I can have longer visits to make sure I do everything possible to take care of you and also look at you as a whole person. So we come up with a comprehensive treatment plan, which includes assessing for medications, but I don't like to give medicines. My mantra is minimal medication for maximum effect. So if you don't need it, I'm not going to give it to you. But looking at other areas of ways to help you feel better, from diet to exercise to light therapy, just a wide variety of things. And I'm here. So the great thing is you can get to me. I have 15-minute free consultations that you can book at AskDrGoodwin.com, AskDrGoodwin.com. You get time with me. There's really nothing to lose. So if you know anybody that needs this, tag them. If you know anybody that needs it, share it. And also, if you're watching it later, hashtag replay, put comments later. That is fine. Valerie says a closed mouth don't get fed. You are right. Thanks for coming on, Heron. Great to see you. I miss good old Missouri. And that's what I got for you tonight. Please take care of yourself as usual. Same homework. Call someone. Tell them you love them. You get to get some love. You give some love. Great way. We're going to get through all this with love and hope and grace. The next thing too is I will be on tomorrow night at 7 p.m. for the mental wellness check-in. I look forward to seeing you, and I will be somewhere other than my car. So take care and stay blessed.